Welcome back. You know, it's the time when we get to sit here at the final day and sort of look back. I know you guys have been busy as all get out with the meeting. So, Chris, if you had some highlights, what sort of strikes you?
Well, in our realm of acute coronary syndromes, there was a study of secondary prevention with a novel antiplatelet agent. Vorapaxar goes after the thrombin receptor antagonist. It worked. It reduced recurrent cardiovascular events in the post-MI setting for the next 2 years. But as we've seen with multiple classes, there's a bleeding balance to that. It was dangerous in patients with prior stroke, so increased intracranial hemorrhage. Again, another theme that's been seen. And so it's reinforced the idea that we have to be careful with patient selection of finding those who will benefit in terms of event reduction and not create too much bleed.
Super. Paul?
Well, I mean, and I think that that's the key is patient selection. You know,
Sure.
being able to identify the folks who are going to benefit the most and avoiding those patients who are at increased risk. And again, you know, with every one of the anticoagulants that we have used post-MI, that's been the recurring
story.
thing.
Yeah.
Absolutely, no. So, Paul, tell me what interesting studies from your things.
The Stampede, you know, I think the country's overwhelmed with this obesity epidemic, and the fact that bariatric surgery, with using two different types of surgery, appeared to have significant improvement in metabolic consequences of obesity.
Quickly,
even before you lost the weight.
That's dramatic. I mean, I had a
exactly.
chance to talk to the lead author, and he was saying that within days prior to discharge, things were kind of, they would discharge people that had been on all the agents and discharge them on no agents.
That's right, and these were high-risk individuals, type 2 diabetics, who you know are going to be at increased risk for subsequent cardiovascular events. And so the fact that we can really see these tremendous metabolic changes and reduction in the amount of diabetic medications that they require, you know, I think really has a wonderful potential.
And we'd have to obviously look at the long-term
Sure.
Yeah.
efficacy and
Well, I
safety.
think, to me, this conceptually changes what we might think of as bariatric surgery of more cosmetic.
Right.
To this is a treatment to prevent heart
Therapeutic.
disease and the consequences. And so really a very beneficial cardioprotective approach.
Yeah, I mean, it was really dramatic. Chris, other things that caught your fancy?
Well, another area of it too is lipids, and so there were some really dramatic results here with a new class of drugs. Again, the PCSK9 inhibitors modulate how the LDL receptors expressed more can be expressed with an antibody. And so there are data here presented of a 72% reduction in LDL. Now, this is sub-Q injection given either every 2 or 4 weeks, so a little bit more than taking a pill, but huge efficacy. Well tolerated. It was a phase 2 study, but this is a new class that is now undergoing extensive testing. I think very promising.
Okay, Paul, comments on this?
I mean, that certainly offers us a tremendous potential, and I'm hopeful that. I know there was one case of vasculitis something that was reported in the trial, and hopefully that won't become an issue when we get some more real-world experience, but it certainly has tremendous potential.
Other things. There was a trial called the Einstein PE that caught my attention.
Well, this is, again, another new class of drugs.
Yeah.
There's been a lot of talk of the novel anticoagulants replacing warfarin, where you don't need monitoring, actually seeing better efficacy and safety, depending on the trials. Now extending into the highest risk venous thromboembolism patients, those with pulmonary embolus. They used a high dose initially, then tapered down as an all-oral treatment as opposed to the sub-Q low molecular weight heparin and warfarin with adjustment, et cetera, and found equivalent outcomes and maybe a little advantage on bleeding. So I think a new option in the management approach to pulmonary embolus that then is broadening all the patient populations where we could introduce the new anticoagulants.
Right. Paul, thoughts on that?
Well, I mean, it's inevitable that we're going to expand the indications for these newer agents, and it makes sense that it would work. It certainly, I think, is going to help with compliance, and hopefully there won't be any bleeding issues, above what we see with our usual treatments. Again, I think that science advances, and hopefully we'll all be the beneficiaries.
It was interesting to me to look at the continued, I think the advances that the college and the Society of Thoracic Surgeons have made in joining on, looking at this whole introduction of how you introduce the new technology, the TAVI, TAVR valves and everything else. So that continued with the really, I just saw Mike Mack walking to a session, and, he's the past president of STS, and the concept of really this teamwork approach, which is going to make sense as we move in the future.
David Holmes made this point in his introduction. The teamwork approach is now, thankfully, our general approach, and especially in the TAVR where it's needed.
Right.
Some great results here, 2-year outcomes, very durable benefit in terms of outcomes and valve orifice, et cetera, for TAVR. So this looks like it's something that's not a short-term quick fix, but one that really changes the course of aortic stenosis.
And as our technology improves, hopefully the collaboration will continue, and we'll continue to have the surgeons engaged in our decision making, and hopefully that'll benefit patients.
I think to David and Mike's credit, and the college and the STS, they've really formed this relationship. And if you look at a technology rollout that looks very exciting, this relationship of defining who can do it, how you do it, you're part of a registry from day one, is very, very exciting to me. So, well, listen, I thank both of you. You guys have done a super job, as you always do. You've educated me. I appreciate it. I'm just up here, talking along, but I really appreciate it, and thanks for joining us. And we want to thank all of you for joining us for this portion of ACC 12.